Injecting drug users are a particularly vulnerable group of clients, and they tend to neglect their primary healthcare needs and in particularly don't tend to get viral screened or vaccinated. Now, if they're injecting drug users, they tend to be particularly prone to picking up bloodborne viruses, particularly hepatitis B, hepatitis C and HIV. The aim of the project is to decrease the incidence of hepatitis B among our cohort through vaccination of hepatitis B, and we want to increase the uptake of viral screening among our client group as well as raise their awareness of bloodborne viruses.
Back in 2007, there was an audit carried out, a viral audit and a Hep B vaccination audit. 34% of service users were vaccinated with Hep B, and 30% had viral testing. So from then, obviously, we had to do some work on that. In relation to the Hep B vaccinations, you do need a clinical environment for that, and we came up against a stumbling block with our Lisburn site because we don't have a clinical area there.
We negotiated with our inpatient unit here in Shimna House to utilise their clinical room, and we also entered a bespoke partnership with GP colleagues in Lisburn Health Centre, where they offered us a consulting room and full use of their clinical room, as well as the GPs agreeing to remain on site when we vaccinated our clients in case of anaphylaxis. For those clients that consented to treatment, we sent letters. We also sent them text messages, and on the day prior to and on the morning of their appointments, we telephoned them directly to remind them of their appointments, which actually increased the uptake of the vaccination and screening.
With our client group, they have a problem with venous access due to the nature of injecting drugs intravenously. They can develop things like abscesses, ulcers, that sort of thing. So we had to be creative and look at ways of addressing that.
Through a fortuitous conversation with a drug company rep, on behalf of the Trust, I entered a business case with them and managed to secure a grant for the purchase of dry blood spot testing kits.
The benefits of blood spotting are that they're very user friendly. It doesn't have to be done in a clinical environment, and again, we don't need venous access. It's just a prick of the thumb, and you have your full test. So from that, we were able to vaccinate. We were able to test more people, and the earlier we test someone, potentially the earlier we can detect a virus, the earlier we treat them, and the better the outcome.
There's been no cost to the Trust as a result of this, and we continue to use this method of collecting blood samples both in our clinical and satellite clinics.
We secured recurrent money now for drug spotting regionally, so it's not just an impact on our service but on all the other services in the country.
We also offer advice on safer sex, more blood-borne virus information. We look at harm reduction advice, which also includes advice on sharing needles and syringes and the complications thereof, and also the availability of our local needle and syringe exchanges.
Another thing we've done is naloxone training. Naloxone is a drug which is administered IM, intramuscularly, and it's used in the event of opioid overdose. So we all have attended sort of regional naloxone training, and we're the first service in the country to have 2 service users trained as trainers.
I think it exemplifies team working, our commitment to our client group. It involves a lot of innovative thinking. It also looks at our partnership working, particularly between primary and secondary care, but also statutory services and the private sector.
So the net result of all this was that compared to 2007, where there was 30% of people who were vaccinated with Hep B, there's now 70% of people vaccinated, and where 34% of people were viral tested, there's now 80% of clients viral tested.